I'm so excited to introduce everybody today to Dr. Zafar Chaudry. He's the Senior Vice President and Chief Digital and Information Officer for Seattle Children's Hospital. Thanks for being with us today, Zafar.
Hello, Kim. It's a pleasure to join you today.
Well, let's dive right in. We'll give everybody a little background on Seattle Children's. Seattle Children's is one of the largest pediatric facilities in the world. You're operating across 46 sites in 4 different states, supporting about 13,000 users. And your IT infrastructure has experienced a variety of stress tests, starting with the pandemic. When that hit, everybody who could work from home did shift to work from home. And then, as if that challenge wasn't enough, we've also been experiencing some extraordinary heat waves in the Pacific Northwest over the last few weeks. I just love to hear a little bit more about how your IT choices have enabled Seattle Children's to handle these challenges.
Our partnership with Nutanix started just over 2 years ago. We wanted to build a platform for our end users so that they could consume their virtual desktops anywhere, anytime. So the model was simplify, standardize, consolidate, be able to scale, be able to run hardware, storage in a single plane. So we partnered with Nutanix, and the goal was to supply virtual desktop infrastructure to those 13,000 users by shift. And so we embarked on that journey. And yes, as we were building that out, the pandemic hit, and we were able to scale within 24 hours to about 4,500 virtual desktops in real time per shift. And I'm pleased to say that in the last 18 months, that virtual desktop infrastructure has consistently delivered 99.998% uptime. So services are available, and services have to be available. Our clinicians have to have the software tools to treat the patients.
As you just mentioned, a reliable IT infrastructure is not just about the users, it's about the best possible patient care. So tell us a little bit more about how that reliability impacts the work that the people you're supporting do.
Well, in today's use case, and as we move more towards the digitization of the healthcare record and access to medications, electronic prescribing, allergies, all of that information has to be available at the point of care. A physician, a nurse, a allied health professional, while treating a patient, needs to know what medications is this patient on, what chronic illnesses does this patient have, what allergies does this patient have. And if systems are down, if you don't have access, then you're really flying blind, and that can provide a risk to patient care. So having a stable infrastructure, continual access at the bedside, at one of our 46 sites, in any of the 4 states that we operate in, was mission critical for the services that we offer.
And cost matters, obviously, particularly in healthcare. And you mentioned when we spoke a few weeks ago that Seattle Children's covers the cost of care for patients who can't pay. So every dollar that you save in infrastructure, in IT infrastructure, can be redirected into patient care. So how does this impact the choices that you make as the CIO of an organization like that?
So the interesting thing about being in healthcare IT and also being a physician is that every dollar does impact patient care. So for every 250,000 I spend on a technology solution, that is one less patient with cancer we can treat. And Seattle Children's maintains that any child that comes to us for care and can't pay, we will cover that under uncompensated care. And in the last sort of fiscal year, we invested over 200 million plus in uncompensated care. So I have to be very careful about the technology solutions, software, hardware I buy, because I'm always thinking about, well, how many more children could we have helped versus paying for a piece of hardware?
Well, we're getting really to the end of our time together today, but I wanted to let everybody know that if you're interested in helping to support families who can't cover the cost of their children's care, you can donate to the Seattle Children's Foundation. There's a link that's being posted to our chat, and of course you can find them online if you don't make that if you're not able to do that today. And Zafar, I just wanted to thank you again for sharing your insights and joining us today. And we just wish you the very best as you continue your good work.
Thank you, Kim. Thank you for the partnership.
Sure, thank you.